Florida Medical Association, helping physicians practice medicine.
Welcome to the Medicine Curated podcast. I'm your host, Tim Stapleton, and we have a very special guest today, someone that I've known for over 20 years and someone who's been a mentor to me throughout my time at the Florida Medical Association. He's now a member of Congress, and it's our own Dr. Neal Dunn. Dr. Dunn, thanks for joining us today. I'm gonna run through your bio real quick because I want people to know. Who you are. Dr. Dunn grew up in an Army family and lived all over the world before he attended college. I think he lived in 20 different places before attending college at Washington and Lee University. He went to medical school at George Washington, and then he joined the U.S. Army as a surgeon. Completed his residency at Walter Reed Army Medical Center, and completed a surgical fellowship at Duke University. It was after that he continued his surgical career in many stations around the world before finally settling in Florida. Settled in Bay County, Florida in 1990. It was during his time at Walter Reed where he met his wife, Leah, and they've been married for over 30 years. I don't know how she puts up with you for that long, but you know. So Dr. Dunn was a surgeon in Panama City for 25 years and was the founding president of Advanced Urology Institute, a 45-physician practice with over 400 employees. He also founded the Bay Regional Cancer Center and pursued a special interest in advanced prostate cancer. He sat on the Governor's Prostate Cancer Advisory Council and the Florida Blue Physician Advisory Board. Prior to being elected to Congress in 2017, Dr. Dunn actually served on the Board of Governors of the Florida Medical Association.
That's right.
And he was also the president of his county medical society, chief of staff of Gulf Coast Hospital, and was a director of the Bay Medical Center's Sacred Heart joint venture. He was recognized as a healthcare hero by the Florida Department of Health for his chairmanship of Bay Cares, which is a medical charity headquartered in Panama City that provides almost $30 million worth of free medical care annually to the working poor in Bay County and the surrounding counties. Dr. Dunn lives in Panama City when he's not in Washington, D.C. with his wife, Leah, and they have 3 children and 3 grandchildren. So, Dr. Dunn, thank you so much. It's good to see you. I think the last time I saw you was right before COVID. We were up in D.C. last February.
Wow. The time flies when you keep it busy, but it must be the longest period of time we've gone without seeing each other in 20 years.
That's right. Well, we enjoy coming to see you in D.C. and now you're beginning your 3rd term. I can't believe it. Your 3rd term in Congress. So tell us a little bit what it's like to be a physician serving in the United States Congress.
So it's certainly been different this last year than the first 3 years. But, I would say that you do feel very, you work with some great people, but you also feel needed. It's never been more important than it is right now to have doctors in Congress. We're in the middle of a worldwide medical emergency, and the world leaders need medical understanding. They need the insights that we can provide for that. So I would say that, we feel appreciated and actually, we get a lot of people listening to us. In fact, I kept my medical license and I probably treated, I would say 50 or 60, maybe more members of Congress for COVID. Yeah.
Wow. Well, you're a member of the Congressional Doc Caucus. Tell us a little bit about the Doc Caucus and how influential that group is in helping shape healthcare policy.
That actually is an interesting group. They existed as a caucus before I arrived, but they have over the last few years become much more influential simply because people are paying more attention to healthcare. So everybody's talking about healthcare. Everybody thinks they understand healthcare, but there really aren't that many of us who have the insights into like the doctor-patient relationships, what the cost is to deliver medical care. And so, we have consequently gained more influence and, by the way, become more organized. I will say the vast majority of the doctors in the House and Senate are all in one party, Republican mind. But we do have three Democrat House members who we work closely with. They don't actually caucus with us, but we do speak quite frequently. And we work very well with the four senators who are physicians as well. So this is a bicameral kind of a caucus, and they're members of that. And as we get together and talk about medicine, when we speak with the unified voice of medicine, people listen to us. And that's important. We had a lot of say in Operation Warp Speed early on. I felt like they ignored us on the therapeutics. We got through monoclonal antibodies and convalescent plasma. We couldn't get them to get into the small molecules. They got remdesivir, obviously, and there were a few others they tried, but they're going to be taking another swing at therapeutics here in the current relief package, which we will be marking up for healthcare purposes tomorrow and Friday. So that's really right on our plate right now. So the Doc Caucus is very central. In fact, I've had one Doc Caucus meeting this morning. We'll have another one this evening, getting ready for this markup.
So you guys meet quite frequently. One of the things that is interesting about Congress is, it really matters what committees you're on. And this year, we're really thrilled that you were appointed to the Energy and Commerce Committee, a very influential committee, very important committee. So tell us a little bit about that appointment and how significant that is in terms of your ability to be involved in healthcare issues.
So you're quite right about that. The committees have they have authorized areas of jurisdiction, and healthcare. The big healthcare committee is a subcommittee of energy and commerce, and so I moved on to that this year, and I am on that subcommittee, health subcommittee as well, which is a very keenly interesting place because of the sheer volume of commerce, healthcare commerce that goes through that, and that we have influence over. And we'll be marking up, for instance, in the next session, we're going to be submitting a bill to the floor next week. We're working on that, all those provisions in the next 48 hours. And that's a $385 billion package just for healthcare. It's part of a $1.9 trillion relief package. Most of that, unfortunately, is in unemployment benefits that are destined to slow down the economy. But the healthcare side is what our committee's on. Now, that overall committee is interesting, as you said, because they have very broad areas of authorization, the broadest in Congress. So telecommunications, commerce, food and drug safety, research. So we have all of NIH, public health, environmental quality, energy policy, interstate and foreign commerce. So, it's just a huge amount of stuff that we dabble with. By the way, professional sports teams, too.
Wow. That is interesting.
So it's a pretty interesting committee. Unfortunately, we didn't get to go to the Super Bowl this year. We're busy working on a COVID relief package.
Right. Well, so it's safe to say that anything involving healthcare probably touches the Energy and Commerce Committee at some point, or it originates there.
That's absolutely true. I had the privilege of serving as the chairman of the VA Health subcommittee previously, and I thought that was a big chunk of responsibility. We worked with about $110 billion a year budget, and now we're looking at the numbers are staggering.
That is, it's very exciting. It's great to have you on the health subcommittee as well. And, who knows? If you stay there long enough, maybe you'll be chairing that committee someday.
That's
that
a
would be
very
wonderful.
senior committee.
Right.
I'm not the youngest guy on it, so.
Well, you're not that old, That's the way it works, though, in Washington, right? You just the longer you're there, the more seniority you have, and then you get to move up and so forth. But being on that committee in just your third term, I think really says a lot about what your colleagues think of you, and the fact that being a doctor certainly brings a lot to the table on that committee. So congratulations on that. Anything else that you're working on, or let's talk a little bit about the end of last year. There were some pretty big healthcare issues that impact doctors that came right down to the wire last year. You want to talk a little bit about that?
Yeah. So there really were some big ones that we covered, and most of this I think we're focused on the new payment fee schedule, and which was really destined to do a lot of harm to specialists, and all in the name of helping the primary care doctors who certainly, are undercompensated on the previous PFS. But, the cuts were going to be draconian to specialists. And I'm sure you were hearing, as I was hearing, this is it. It's the end. We can't keep our doors open as independent practitioners anymore. And even large groups like mine were struggling with that new fee schedule. And so we went to bat on that and found some ways to change that. And actually, it was pretty amazing. I mean, so we injected some money in it to start with to offset, frankly, the fee schedule, keeping it the way it was for the specialists, and also suspended the sequestration until March, which cost us another $3 billion we could use, and blocked the G2211 HIPPICS code, which I'm sure you're aware of was the primary code that was going to be expected to be used by primary care. It was so expensive that by blocking that for another year, we got a huge raise on that too. So overall, it looks like the physician specialties across the board are going to average almost 4% raise in 2021, calendar year 2021, as opposed to what they were expecting, a 6 to 10% cut.
Yeah.
So that was we felt very good about and that was the final last ditch in the trenches. New Year's Eve kind of.
We were all sweating that out. I know.
Yeah, and the surprise billing fix, which you had your conversation. We had several conversations over the last couple of years about that, and you got all your ideas in that. So we worked hard on that, and the Doc Caucus was instrumental, by the way, in both of those sets of legislation. So I'm proud to be part of that effort. Also saved the alternative payment model thresholds, so they didn't raise it, and that kept a lot more people in their APMs and helped the rural hospitals and rural providers as well. So and there were a lot of wins in the last month or two there, but they represent 2 years of work too, I should say. Just because you pass the bills all at once in these omnibus moves, but you lay the groundwork for a couple of years.
Yeah, everything comes down to the last minute, and it certainly did this year. Well, that's a good segue, as you talked about the influence that you and your other physician colleagues were able to have on those pieces of legislation at the end of last year. So that's a good segue. It's something I wanted to talk about. Before you were in Congress, you were very active. One of the most active physicians that I know of. You were very active in the legislative and political process, working, with the FMA. You were, pardon me?
You talked me into it.
Well,
Carl Altenberger.
I will plead guilty to that charge, but certainly, you were the chairman of our legislative council, and the importance of developing relationships. You developed very close relationships with, people that were candidates that ended up becoming senators, that ultimately became the president of the Senate, somebody that you got to know before he was ever elected to the Senate, and that was our friend President Don Gates. And so I'd like you to talk a little bit about that. The importance of physicians being involved in the legislative and political process, making friends, building relationships, and how over time that really benefits not only doctors but patients.
Well, I'm glad you said that because first off, I should say that I'm deeply grateful to you and all those names and others who convinced me over the years to stay active in organized medicine because we did shape law and we did shape policy at the FMA, and we did it in Tallahassee and we did it in Washington D.C. And so it was very gratifying to me to see we can help our profession, but that helps our patients. So we're doing this for our patients, really. I mean, we got to protect the doctor-patient, physician relationship. If we don't do that, then there's really nobody advocating for our patients besides us. It's not the hospital, it's not the insurance companies for sure, and it's not the government. It's us who recognize what our patients actually need when they're sick and injured and in these awful situations like pandemics. So that was grateful. But there was something else I'm grateful for. And a lot of those people you mentioned that we form relationships with, and I'm going to talk about those, the importance of those, but those are some of the finest people that I've ever worked with in my life. And they've become deep, deep, fast friends. I mean, you mentioned President Gates. I mean, he and I remain as close as brothers. And I'm deeply grateful for the chance to call him my friend, even if he hadn't been president of the Senate. I mean, he's just a 4+ great person. Jerry Shieber, John Frasher, Speaker of the House. I mean, these are wonderful people that it gave me a chance to work with. And one of them, the only people that you had me work with that I can remember when you introduced us was Senator Al Lawson. He was running for the state Senate at the time, first time. And we became good friends during his, he's Democrat, but we worked together very well. Now he's in Congress with me. And
how interesting is that? He's a colleague in Congress. He's one of your neighbors, and your other neighbor is Senator Gates' son, Matt. So,
absolutely right.
Who would have thought? When we started this journey together 20 some years ago, that's where things would end up. But
you can't predict this stuff. Al Lawson, Senator Lawson, I still call him Senator. Although he's Congressman, I call him Senator because it riles everybody up. You'd say, "Hey, Senator Lawson," and everybody looks around. Where's the senator? But he and I just did a seminar for the poli-sci class at FSU, and it was on civility in politics.
Wow,
I like that. So it's fun.
Well, it's important to show, particularly in these times where things are, so hyper political. That it's important to be able to show that you can have friends on the other side of the aisle, and certainly the relationship with Senator Lawson, I'm going to call him Senator too, goes way back, and that's a great example. The
FMA actually is much better at that, I would tell you, than most medical associations. So of the, let's see, 11, 14, there's 14 docs in the Doc Caucus. We get exposed to other states' medical societies. There's only a handful of state medical societies that enjoy the high profile that the FMA does in Washington as well as in the state capital. So that it's just another reason to be involved if you really care about your profession.
Well, and you never know where it could end up. You could end up being a member of Congress at some point. I'm kidding. But certainly, and I remember when you talked about running, initially I was not very excited about it because I really liked working with you, and I saw that one day you were going to be the president of the FMA, and I hated to lose one of our best, advocates. But now you're at a stage that's much greater, and you can do much more good for people. Tell us a little bit about your district, because you have a district that's by geography the largest district in the state of Florida. Tell us how many counties that encompasses.
Yeah, so it's larger. It's 19 counties, and it's larger than any other east of the Mississippi. Of course, it's not as large as Alaska, which has one congressman. But it's a lot to drive across. And but it's another opportunity to meet a whole bunch of really great people. And you and I are both extroverts. We like to meet interesting people, and there's a whole bunch of them between here and Ocala. And I have an excuse to go meet just about every one of them. And they're really some very clever people. Who have terrific ideas about how to help in all kinds of areas, whether that's medicine or agriculture or what. But the people out by predisposition that I get to meet are people who want to advocate before the legislature, and they understand that it's important to their professions. And I think it is important. Most legislators aren't evil; they're just misinformed, whether deliberately by your enemies and my enemies, or just because they stumbled into misinformation. But so it's important to inform people. And you mentioned before the relationships. It's much better to get to know and have a trusting relationship with your representative before you need him or her to do something for you. Because, those are the relationships that we trust naturally. And we lean on those people. It's not infrequent that I call you, for surprise billing. And then we started out not on the same page. And, you won me over. So I hope you like the result.
It's like anything else, you get to know people on a personal level, and before you're in a position of being elected to office, you go back to those people that you knew before, and that's what we always try to preach to doctors. Get to know the candidates that are running, get to know them before they get elected, and they're going to remember you, and they're going to remember that you were somebody that gave good advice and that they can trust and so forth. So I appreciate you touching on that, because that's really been one of the stories of your career. Certainly, it's just getting to know people and build those relationships, and it just leads to great things. So thank you for sharing that.
I have to admit, here we are, 2 decades into this relationship, and I have to admit you were right. I didn't think you were at first, but
well, and you're right. There's so many. We've had the privilege of being around a lot of people that we've learned from over the years, and now you're one of those people that other doctors can learn from, and it's sort of that paying it forward mentality. But you're busy.
In that sense, I mean, I'm humbled by the people I meet and work with daily. I mean, they really are some extraordinary, generous, giving, heroic personalities.
Absolutely.
And there's some knuckleheads too.
Well, yeah, I guess in any business you're gonna run across that. But you're a really busy person. I appreciate you taking a few minutes and talking with us. Look forward to coming up to DC to see you again, and bringing some of our physicians to visit. And I know we'll see you around. You get to Tallahassee quite a bit, and so we'll see you as you come through when you're back in the district. But do you have any parting comments or anything that we missed that you want to touch on?
I can for a lot on COVID. I think that we got some things wrong, honestly, on the quarantine, the pandemic response, especially on the therapeutic side. I'm actually trying to inject a few $1 billion into therapeutics in the next 48 hours. Stay tuned. So there's when COVID, I would ask the doctors to be a conduit of information for everybody in the community, but also to be aggressive about it. I mean, and positive. Well, we can beat this thing. We can do the right things. There are countries that are way ahead of the United States, frankly, in addressing the death toll and the incidence toll. And that they're doing it with therapeutics without the vaccine, because they haven't got the resources to create a vaccine. So we've been single-minded on the vaccine, which is good to have it. I mean, God, I'm grateful. and I spend a lot of time and effort to getting more vaccine.
Sure.
But I think we need to space some, and we need the doctors to lean in and start thinking about prevention and treatment. And there's some good things there. If you wonder what it is, come to my website. We can talk to. And obviously, they're doctors. I'm happy to talk to them on a professional level. I think it's also really important that we keep organized medicine involved in these efforts in the pandemic. We've got the world really shut down for a virus we have done in total probably 30 to 40 trillion dollars of damage just gone, evaporated. World wealth gone because of this pandemic and its response. We need to kind of pick ourselves back up and get moving forward, or we cede the ground to China.
Another thing that I know you care about, because in your career you dedicated a lot of effort towards cancer treatment, and one of the things that we all worry about is during the pandemic, people that have canceled their appointments or maybe put off screenings that are critically important. And I think we're going to see some of the other effects of COVID being people not being treated for the care that they normally would have gotten. And because of COVID, they were either afraid to go see the doctor or they put it off. So, you want to talk a little bit about that and just the importance of people continuing to stay up with their health care.
So the epidemiologists who come to Congress and talk to us about this phenomenon, the missing care, they estimate that we have probably lost or will lose about as many people on the other side of this from a lack of attention as we lost from COVID. So, wow. I mean, you're when you count COVID deaths, you're probably catching half of the deaths due to this pandemic. And some of them are still coming at us, the metastatic cancers that we could have cured had we seen them last year. And we get them this year, and it's too late to cure. So things like that. And heart disease. These are simple heart disease. I say simple, but we're not addressing it the way we did. So if you look at the incidence of deaths and heart attacks, it's way, way, way down. Do we believe that's true? No, it's just not getting reported or looked for. And so that the heart disease alone that's coming at us is something there. And then notice I haven't even touched on the mental health issues, which are enormous. Everybody talks to us about that. So I think that there's a lot of reasons for us to be engaged with our communities and with our organization, organized medicine, because we've got a lot of repairs to do for society, for the whole world.
Probably now more than ever because of COVID. Well, again, thank you. It's good to see you. I wish we were face to face, but at least I get to see you over the computer screen and give our best to your family, your wife, Leah, and we appreciate all that you're doing, and thank you for your service to the people of Florida.
Well, you've been very kind. You've been a great leader for a long time there, Tim. And I guess now I've gotten so used to you being right, I'm just going to have to assume you might be right next time you come up and tell me.
I'm not always right, but I appreciate that very much. Well, thank you. Thank you.
Friend, hey, you take care.
All right.
Florida Medical Association, helping physicians practice medicine.